Welcome to Helen on Let's Talk Health. I just had my annual eye examination with my optometrist yesterday, and she told me my astigmatism has gotten worse. I know I have had this condition ever since I was in high school. But what exactly is astigmatism? Let me find out from Dr. To once and for all.
Hi everyone, I am Dr. Charlene To. I am an optometrist, and today we're going to talk about astigmatism. So astigmatism is a term I explain to patients every day, and probably a term that you have heard of. It's a very common diagnosis, and what it is really, when you have astigmatism, it means that your eyeballs are shaped more oval instead of round. Astigmatism is not a disease, it's just a condition, and it can be corrected with glasses, contact lenses, and laser eye surgery. To better understand what astigmatism is, we have to take a look at the cornea of the eye, which is the front surface of the eye. The cornea helps bend light to the back surface of the eye, which is the retina. So if your cornea is perfectly shaped and even, light will bend evenly to the retina and it will focus at one point on the retina. If your cornea is curved, has an uneven curvature, then the light will bend unevenly to the retina and causes it to focus at different points on the retina, and that's what causes things to be distorted and blurry. So a good example of that is those funhouse mirrors that we've all played with. So those funhouse mirrors, when you look at it, they are very curved, they are uneven, right? So when you look at it, at the uneven and curved surface, when you look at yourself, you actually see a distorted image of yourself. That's kind of like what astigmatism is. When the cornea has an uneven curvature, we call that corneal astigmatism. This type of astigmatism is pretty stable throughout life and doesn't change very much. There is another type of astigmatism, it's called lenticular astigmatism. This type of astigmatism occurs in the lens of your eyes and it can change throughout life. So when you go in for routine checkup, your optometrist actually measures both lenticular and corneal astigmatism together and put that in your prescription as a whole. If you want to find out whether you have astigmatism or not, just look at the last prescription that your optometrist gave you. So if you look at the prescription, there's different columns. The first column is SPH, which stands for sphere. This is how much nearsight or farsighted you are. So if the number is a negative number, it means you are nearsighted. If the number is a positive number, it means you are farsighted. The second column is CYL, which stands for cylinder. This is how much astigmatism you have. And this number is usually in negative. It's a negative number. The higher the number, the more astigmatism you have. The third column is the axis. The axis is the location or the orientation of your astigmatism. The axis can be anywhere from 1 to 180 degrees. So if you have a number that is under the cylinder and the axis column, that means you have astigmatism. The other columns on the prescription, one of them is prism. This is for people who have fusional problems and have a hard time putting two images together. They would usually have a prism power, but this one we don't use it very often. The other column is the ADD, the add power. This is the additional power that people would need when they need bifocal or reading glasses. So take a look at this image here, the eye chart. So on the left, we have a perfectly clear eye chart, and this is what normal vision would look like. Now next to that, that's to show you what one diopter of astigmatism, what what would vision look like with 1 diopter of astigmatism. So it gets a little bit blurry. Next to that, it shows you what vision would look like with 2 diopter of astigmatism, so more blurry. And then next to that, the last one, that is vision with 3 diopters of astigmatism, and you can tell the eye chart is completely blurry and very distorted. Here's another example of what vision would look like for someone with and without astigmatism, especially at night. So in this picture here, you can see that on the right, that is with astigmatism at nighttime, very blurry, and all the lights, they have glare on it. So that is what someone with astigmatism would see at night. Fortunately, most astigmatism can be corrected with glasses or contact lenses. The contact lens that corrects astigmatism, they're called toric lenses. These special toric lenses have a marking on the lens that helps your optometrist to determine whether the lens is sitting properly in the right position on your cornea. And if they're not sitting on the right position on your cornea, then your optometrist have to make adjustment to the contact lens power. There are times when astigmatism cannot be corrected with glasses or contact lenses. So when astigmatism is so severe, they actually become a disease. One of the disease is called keratoconus. So this happens when the cornea actually bulges out like a cone, and this causes light to bend very differently and causes things to be very distorted. Alright, so that's it for astigmatism. I hope this video helped take the stigma out of astigmatism. And if you have any questions, please ask your optometrist.
Thank you, Dr. To. Now I know what each number means on my prescription. If I look weird now, I think you have astigmatism. Just kidding. In any case, you should have an eye examination every year. In Ontario, the cost is covered by OHIP if you are 19 years old or under, or if you are over 65. I hope you learned something new today, and please remember to share this video and subscribe to my channel by clicking this circle. See you soon!